It's very difficult to answer that, really. I think for me, it wasn't so much about skills, but it was about self-confidence and self-assuredness. And um, it wasn't until I went my fellowship to Brisbane, Australia, where I worked with Peter Myers and Peter McMenamin, that I learned that I was all right. I think it'd be fair to say I didn't learn that I was any better than that, but I realized I was okay at my work and my job, and it absolutely meant the world to me. I've often said that my fellowship was the best year of my life. I now say actually it was my most important year rather than best year. It was a wonderful year, experience and enjoyment and fun and all that. We had all that interesting work without the ultimate responsibility. My poor bosses had that. But to come home with a sense of being okay for me was amazing, because people who know me now didn't know me then just won't believe it, because I'm so confident. And I usually describe myself to patients as, I am so confident, but I'm worried sick all the time. And that's great for the patients, I guess, but it's not so good for my guts. But it certainly, I was very lacking in self-assuredness. And having now been a trainer myself and trained fellows, there are one or two who've come through who clearly was supercharged at a young age. And you can be self-confident without being arrogant. I promise that's true. Now, one or two who've gone on to very great things, one in particular I'm thinking of. And I think in some ways my lack of self-confidence probably was a handicap when I was younger. But the truth is I've done all right. So I'm not sure how important it was. And maybe that lack of confidence actually helped me, because I think that all my bosses when I was training realized that I was very serious, and I would phone them if there was a problem. And I think now when I was working in NHS, having registrars who were a little bit worried were my favorite group, really, because I knew I could trust them. So although I've answered a question, maybe it would have been detrimental to being too confident too young. I don't know. But there was one thing I'm envious of the odd person who comes through. I think actually they had the ability, but also had that self-assuredness. And I think that gives an advantage when it comes to career planning and also aspiration, because I had no dream really that I'd end up where I am now, because I just thought it was beyond me. But that year in Australia really changed how I thought, and I suddenly realized I needed a teaching hospital job, and then I needed to do research, and I needed to do this and that. And so maybe that was the one thing I was missing. There's one thing that always irritates me, and that's whenever I get introduced at a sort of sports-based meeting, they say I'm the Chelsea surgeon. Well, first of all, there's no such thing as the Chelsea surgeon. It's up to Chelsea who they engage, so there's no permanent position. But also I do a lot of other teams. I do. At my peak, I was doing 54 English soccer clubs, which almost bloody killed me. And now I've cut back a bit, but I do 16, 20 Premiership, but also rugby, which I love, and I do most of the rugby teams in the UK and so forth. So I do quite a few other things apart from Chelsea Football Club. But so that's one thing which slightly irritates me when I get introduced. I think people always assume I was confident. Going back to question one, they always think I was like I am now. I'm like I am now as a product of my anxiety and nervousness when I was young. As a result of that, probably my conscientiousness, and multiple other factors, and the people who trained me and gave me that lift up along the way and gave me the self-confidence, as I say, particularly in Australia, but also in the UK as well. I think there's no doubt there is an element of envy from some people, a little bit of jealousy, and I get a bit of feedback from third parties about the bitching that goes on. I think if the people who fancy a bit of what I do actually realized how hard I work, that would put them and certainly their families off. And so I think there's an element of, being in the position I am, there's an element of people think maybe Andy's doing it for the money, which I can tell you I'm certainly not. And I do all right. There's no question about that. But and certainly nowadays, but I did spend many years actually charging insurance rates for the Premiership footballers, which I think in hindsight was madness on my part, but I sort of felt privileged to do it. And so the assumption is I do very well, which I think is a bit unfair, actually, financially, that is. Um, and so, you know, I think I feel confident that any accusation of me doing this for the fame and glory is not correct. It's certainly been one hell of a graft and a lot of stress and pressure, etc. That there's a price for. But the reasons I do it is I love sport. I'm fascinated by sports-related knee injury, and these people they're gifted and they are capable of doing things none of us ordinary people could ever do, but they have ordinary things that get exaggerated massively. They also get rare things, and by working with this patient group, it makes me a much better surgeon for my non-pro sports patients. And it's very easy to attack doctors who get stuck into sports surgery, but actually, if it wasn't for sports surgery, you wouldn't have this extra level of teaching, if you like, for people like myself, and it makes us better to treat other people. But it also is driven our speciality. So sports knee or soft tissue knee surgery wouldn't be where it is now without professional sport. These guys keep asking the questions and we keep trying to come up with the answers and solutions. And, it drives improvements in practice. If it wasn't for the pro sports teams, we wouldn't have ACL surgery as we do now. And that benefits the whole population. So I'm very comfortable with my skin that I'm doing a worthy thing. Well, the truth is nothing, because I'm so fortunate to be in the position I'm in. Of course, there are times when I feel overworked and I get grumpy and I'm stressed out of my head about something, but I did ask to do this, so it's nobody else's fault, it's only mine. So that does help me deal with it. And if it gets too bad, I'll pack it in, I guess. But I had a bit of a crisis 5 years ago when I really had to pull back. Nothing bad happened, but I think it was very close. I was just worked into the ground. I was exhausted. I had absolute default setting was fear and worry. And when I sat outside my house in my car one day, looked at my house and had the realization I worked so hard for 20 years, and that this 17-year-old soccer player could have everything in mind. I'm not insured enough to cover some of these cases. In fact, all went absolutely well and it was fine in the end, but I was at my low point in terms of my bravado and my sort of self-confidence, if you like. And so that was not good. So, but I changed. I had a little bit of a break and I've got back into it, and I'm feeling strong. So the reality is I know that I'm in a lovely position and I'm very, very fortunate to be in it. Till I was 15, I was going to be a builder. So I take this every time. As I said earlier on, perhaps a bit more self-confidence early on that would have meant I'd have achieved a bit more, but actually I've achieved a lot. So I don't think I can really say that with honesty. I have to say it is irritating at times when you see how any surgeon outside the US is not quite as equal as the US surgeons in terms of their ability to be developed and thrust forward by the system in the States. It's not the people in the States' fault, and there's some great surgeons who deservedly are promoted. But when you look at it, the relationship between American surgeons in industry, etc., the rest of the world is treated second best. So I have to say, I think that's like the only gripe I have. I think if people like myself were in the States, we would tend to be pushed on because we would be good news for the hospital or organisation we were working for. And I do think the rest of the world loses out for that because there are many wonderful surgeons outside the States who don't get the credit they deserve. So maybe that's one little gripe, but that is certainly saying grass is greener. When I'm happiest, I'm usually out to dinner or having dinner at home with very good food, good wine, and usually family. Actually, my absolute favourite times are with the whole family, with my lovely wife, my kids, and my sister-in-law and her husband. We get on incredibly well. And so that's probably the absolute ultimate for me. And I just love, particularly Christmas period is very good. Also south of France every year, it's my therapy. I lie in the sun for 2 or 3 weeks and suddenly get my heart rate down, etc. But the real joy is dining with family. I think my sort of luxury favorite is visiting New York, Manhattan, usually once a year for a long weekend with my wife. We just really have a great time. We got some friends there. We love art, so pop into various art galleries. We're going to go in, I think it's March, there's Edward Hopper's showing at the Whitney Museum, which we usually stay near there in Chelsea. And it's just, I really love being in New York for a short period at least. I'm not sure living there will be the same. What I do and the fact that people are foolish enough to invite me to speak at meetings, I get to travel a lot and meet up with these lovely people around the world. I mean, it's just extraordinary. And COVID has really robbed us of 2 to 3 years of that intimacy that we would have with some amazing people that I'm proud enough to call my friends around the globe. And that's been a sadness, but we're back on the wagon and we're almost there. I think, hopefully next year, certainly the year after, it'll be back to normal. Although I do fear that every winter we'll be getting more COVID cases, but I do think travel is back on. I just hope the cost of it reduces, because it's about twice the cost it used to be. Yeah, obviously I tend to watch out for players I know and have operated on. I've even got one in the Australian team, and he played really well the other day. So that's really exciting. It's obviously him, it's not me, but because of our interaction, it does focus me, and it adds a bit of spice. I've often said that in the English league, virtually every game in the top 2 levels, I've got some reason for preferring one team to another, and yeah, there's always something to look at, and no, it's fascinating, really. So that's quite a difficult thing to answer. But as I thought about it, there are two things that stand out: one book and one holiday. So I realized probably 5 years into my practice that I had an abnormal level of commitment and energy. And not surprisingly, perhaps I got quite interested in motivation and also self-improvement. And I did read a number of books, self-improvement books. And one that I felt was really useful to me is called The Power of Full Engagement by Jim Loehr, Loehr, I think it is. And Tony Schwartz. And I've no financial interest in the book, but certainly for me, it was a very straightforward, helpful guide to living and performance. And, the first chapter is simple. It's very sensible. It just says you've got to sleep properly, eat properly, and take some exercise. And if you can manage to get that into your life, you will be more energetic and you'll be more efficient as well. But the whole book is an easy read, and I felt some very useful life lessons in that, and so I'd recommend that. There was one holiday that changed my life. In 2007, I was 10 years back from fellowship. I was working like a dog. I'd been thrown a number of huge honours and prizes within the business, and it was the drug of achievement was, in my veins, and I was overworked, tired, and falling to bits, really. And I can remember one day, it was a Thursday, south of France on holiday. I was lying on a sun lounger having a beer and listening to music, which I like to do. And opposite, across the swimming pool from me, with my wife and young children. And I realized that unless I changed something dramatically, my life was going to be bad. And that would mean that I would sort of lose engagement with the family. I mean, at that time, during the week, Monday to Thursday, I'd have 4 hours sleep a night because I was editing Grey's Anatomy. Getting up at 5, did I go to bed at 1? It was an incredible period of achievement, but by then I was on the bootstraps. I'd had 3 years of the 4 hours sleep a night thing, and I was just knackered. And when you get into that situation, you don't feel well. You feel nauseated the whole time. It's like jet lag, and I almost resented the kids and so forth for family life because it was holding me back. But of course, that was absolute madness. And I had this realization on that one day that something had to change. It had to change very rapidly. And so I had quite an emotional day on the last day of the holiday, the Friday. And on the Monday, went into work and spoke to my colleague, John Lavelle, who's wonderful, and just said, John, I'm in a bit of trouble. I need to start doing a job share in the NHS. And he looked, I don't know whether he just thought he looked me in the eye and realized something bad was happening, or whether he really did believe in what he said. But he said, yep, good timing, let's do it. So within 12 weeks, we had a job share, and then had a great 3 or 4 years where the pressure was off a bit, and I got back to my good self, and it really re-engaged with the family, fell in love with my wife again. And not that I hadn't, but the more you put in, the more you get out. And so that extra level of commitment and engagement with the family was life-changing. And it's I don't think we'd have split up, because my wife's tough and reliable and amazing person, but we'd have just ended up living parallel lives, I think. And I was fortunate enough to be selected for the ABC Fellowship. I went to the States, and I often, whenever I met the wives of the surgeons we'd met, or the husbands in a few cases, I was always interested to know what their lives were like, and actually what they thought of their partner's success in life. And I was quite shocked by a number of them saying they weren't sure the effort was worthwhile, to some of these household name heroes of mine. And that I perhaps should have learned the lesson in 2001 when I went on the fellowship. Sorry, 2002 when I went on the fellowship. But you get one shot at this. So that was a very, very important holiday, and very, very important day on the holiday for me. Changed my life, thank God.